Hello, my name is Kiara Morris, and I did my internship at Maine Medical Center in the non-invasive cardiac unit. Maine Medical Center is 31 minutes away from campus. If you take the highway, then there are two tolls that you need to go through. Otherwise, without the tolls, it is 37 minutes. Without the tolls, you'll take Route 1, which is right here. Route 1 can be quite busy, so I personally always took the highway, but it is up to you. Once you get to Maine Medical Center, you will need to park in the employee parking garage on St. John Street. From there, you can go to the ground floor of the parking garage and take a trolley to Maine Medical Center. Super easy to navigate. If you don't take the trolley, it's about a 10-minute walk. My site supervisor is Jessica McConaughey. She's a senior ECG technician at Maine Medical Center. Her contact information is below. She is super responsive and very informative. I would highly encourage reaching out if you have any questions or if you're interested in this internship. At this facility, I encountered many different types of patients. It is an inpatient facility, so all the patients have been admitted to the hospital for chest pain, angina, or any other symptoms related to a heart issue. Some of the tests that are typically done are typical exercise stress tests with no additional imaging or tests that require imaging. Tests that require imaging include nuclear stress tests and stress echoes. Nuclear stress tests use radioactive tracer to take pictures of the heart before and after stress. Regadenoson and dopamine are common medications used to stress the heart if the patient is not a treadmill candidate. Otherwise, treadmill exercise can be used. Stress echoes involve taking ultrasound pictures of the heart before and after stress and typically involve treadmill exercise as the stressor. Picture to the right is a picture of one of the stress labs on site. There are 2 total stress labs at this internship. The duties required at this internship involve preparing rooms for each individual test, like getting medications, changing sheets, and typing patient information into the computer. Other duties include assisting in reading medical histories to ensure that the prescribed test is fit for the individual, preparing patients for the tests, like taking resting blood pressures, O2 saturation, and prepping for a 12-lead ECG, monitoring the ECG during the test, taking resting and exercise blood pressures, and doing ECGs for patients around the hospital. Picture to the right is a pink cart, which is full of supplies in the rare event that a medical emergency does occur. This needs to be checked every day to ensure that everything is where it should be and is working properly. The other 2 pictures are images of the other stress lab. It is a lot bigger than the previous lab that I had shown you. Here's some other information about this internship. There's a kitchen where you can store or make your lunch, and a coffee machine that I used almost every day since I was there at 7 a.m. That's another thing, very early mornings at this internship. I was typically there 7 a.m. to 1 p.m. For chemical stress tests like regadenoson, caffeine is a common antidote to reverse some of the side effects, so another duty may to make a coffee for a patient. There are plenty of shadowing opportunities since you get to work with lots of other people like sonographers, PAs, NPs, and radiologists. This internship is strict on immunizations, so make sure you get all the required immunizations if you're interested in this internship. Casey and Jessica do a great job with making sure you have all the required immunizations and forms to make your transition to internship successful. Overall, I really enjoyed having this opportunity to complete this internship. I feel as though I gained lots of clinical knowledge and was able to apply all the information I learned from classes in a clinical setting. Everyone that works there is super nice, and I would greatly consider this internship. If you have any questions, feel free to reach out to me, Jessica, or Casey, as they are all willing to help.